versus the parasympathetic nervous system. Okay, this is a point or an area where I don't think we went into much detail. So we describe what happens in the sympathetic and the parasympathetic separately, but let's just compare them here. So the sympathetic nervous system, we've got our postganglionic neuron, which we sort of just drew earlier. It's got the varicosities, and it's synapsing onto cardiac muscle, smooth muscle, or glandular tissue. Okay, I noticed some of you may have a conflicting meeting. That's fine. I'm going to record this and it will be posted later. So if you have to leave, that's totally fine. Okay. And then here we're synapsing onto the same structures, right? Cardiac muscle, smooth muscle, adipose, or gland. If we look more closely at what's happening at this junction in the sympathetic side, here's our varicosity. Here are our stored neurotransmitters. Because we are on the sympathetic division of things, this neurotransmitter is going to be norepinephrine, mainly. Okay, norepinephrine. On our muscle side, we're going to have an adrenergic receptor, right? So here we'll have an adrenergic receptor that will be specific to bind norepinephrine. This can be any of the receptors that we just mentioned, alpha-1, alpha-2, beta-1, beta-2, or beta-3. So this is going to depend on exactly where this tissue is located. If it's in the heart, it's beta-1. If it's on the kidneys, it's beta-2. Or not the kidneys, excuse me, the lungs, it's beta-2. Beta-1 is heart and kidneys. Beta-2 is lungs and then uterus. Beta-3 is adipose. So depending on where this tissue is, that's going to determine the specific type of receptor, the specific type of second messenger, etc. We can also consider this to be a metabotropic receptor. Okay, we talked about that difference as well, ionotropic versus metabotropic. This is another example of where these are metabotropic receptors. In other words, they are slow receptors or coupled to a G protein. So I'll just mention that here as well, metabotropic. So our neurotransmitter comes out, crosses the junction, binds to this specific adrenergic receptor. The trigger for that, we've discussed this process, is calcium moving into the varicosity, and then that triggering exocytosis, which is what dumps this neurotransmitter here into the junction. Okay. So here's our varicosity. And then here is our effector cell. Let's look at what's happening on the parasympathetic side. So similar events, similar structures. We have a varicosity as well. We've got our neurotransmitters stored in our vesicles on this side as well. Let's just draw these in these vesicles. And then on the adjacent side, we've got our muscle, same types of tissues, but guess what? Different receptors here. So because we're on the parasympathetic side, these are going to be muscarinic receptors. They are also considered to be metabotropic. Okay, they are just cholinergic, and then they are muscarinic because they'll bind acetylcholine. So the neurotransmitter at this junction is acetylcholine. Okay, and the same set of events will happen. Exocytosis because of the influx of calcium that triggers the dumping of this neurotransmitter, and then it will bind to this muscarinic receptor here. Okay, so this is just comparing the different neurotransmitters, the different receptor types at the neuroeffector junction based upon the division of the autonomic nervous system. Let's also remind ourselves that because this junction has acetylcholine, we're going to see the enzyme acetylcholinesterase here, right? That little enzyme that can gobble up any additional acetylcholine. Okay, and then we're also going to have our reuptake molecule. which can recycle any neurotransmitter. Okay. Any questions here? Quickly, we're almost out of time, and I do want to go over the skeletal muscle bit. Okay. The last few things that I've got to review are the cross-bridge cycling and then the excitation contraction coupling. Okay, so just going back to this flow diagram, let's start at the first stage, which is myosin in the cocked form, also in the high energy form, because it has ADP and the phosphate bound to it. So having ADP and the phosphate means that it's in the high energy form and it wants to engage with actin. And so that's kind of the first step that we see here in terms of the cross-bridge cycling. So a cross-bridge being formed is the first step. Now, the phosphate is released. And the reason that we start out with the phosphate already hydrolyzed is so that it can be ready to donate the energy that's required for the power stroke. So after the phosphate is released, then we can have the power stroke. That release of that phosphate means that the energy was donated to move the myosin head towards the M line. So that results in our power stroke. Now, ADP is still bound here. ADP is subsequently released. And so in this phase, I think is where I sort of went off the rails last time, but in this phase, myosin is no longer in the high energy form because it doesn't have ADP or the phosphate bound, but it's also not yet in the low energy form because it doesn't have a new ATP. So the state of rigor here is where myosin is sort of in between the high energy and low energy forms. It's not quite in the low energy form because it doesn't have an ATP, and so it's not going to let go of the actin just yet. It's going to stay stuck to the actin until it can be converted into the low energy form fully, which is when that new ATP binds to the myosin head. So after the new ATP comes in and binds, now it's in the low energy form. Now it can release from that actin. And now it has, because it has a decreased affinity at this point, and now we can see the relaxation of that sarcomere. So rigor here is really the state where there is a lack of ATP. It's not in the high energy form because ADP and the phosphate are no longer bound, but it's also not in the low energy because that new ATP is not bound yet. Now we can hydrolyze that new ATP where we have the ADP and the phosphate standing by, ready to donate energy. That's what the hydrolysis is for. And because we have hydrolyzed the ATP, we're once again converting it from the low energy form where it has ATP bound and it doesn't have an attraction for actin to the high energy form where it now has that ADP, the hydrolyzed phosphate, and now it doesn't. Now it does have the affinity to reach up and grab onto the actin, okay? So going from the low energy form here back to the high energy form is what results in the actin, or the myosin head rather, being able to engage and grab onto the actin. Okay, so that is the cross-bridge cycling. The other piece I'm going to go over is the excitation contraction coupling. This is another area where you will see a few questions, so make sure you go over these two topics in detail and these two illustrations. So first off, we start with the events at the neuromuscular junction. So we drew out these proximal events earlier, the motor neuron synapsing onto the muscle, skeletal muscle here specifically, acetylcholine being released at this junction, acetylcholine binding to nicotinic receptors on the motor end plate. of the skeletal muscle. That results in the action potential moving throughout the muscle, right? Here's the sarcolemma, which is the membrane of the muscle fiber, and also propagating deep throughout the muscle with the help of the T-tubules, which are these channels that invaginate the muscle. From there, it's going to trigger the release of calcium from the sarcoplasmic reticulum. Specifically, the mechanism for this is the DHP receptor, which is a voltage sensor, coupled to the ryanodine receptor, which is a voltage sensor. Also, it is the channel that is on the sarcoplasmic reticulum. So when both of these receptors pick up that voltage change, it will open up the channel on the SR, and calcium will leave the SR where it's being stored and dump the sarcoplasm where it can engage with troponin. So here that calcium binds to troponin. Because of the coupling of troponin to tropomyosin, binding of the calcium results in shifting of tropomyosin, which uncovers the myosin binding sites. Myosin can engage, presuming that the myosin head is now in its high energy form. It has that ADP bound and that phosphate standing by, ready to give the energy for the power stroke. It will make a cross bridge. Cross bridge cycling will proceed. And then in order to rest the muscle or relax the sarcomere, calcium has to be pumped back into the SR, and that muscle contraction will end because troponin will now shift tropomyosin to cover up the myosin binding sites once again. Okay, so that is how we can go from the action potential arriving at the neuromuscular junction all the way to the contraction of the muscle and then the subsequent relaxation when that calcium leaves the sarcoplasm. Okay. Any questions so far? Any questions on that piece there? The other topic I would like to review is just going over the absorptive versus the post-absorptive states. I think that was an area where I got some more questions as well. So in the last couple minutes, I'll go over just a summary of what you need to know for that. But I'm also going to encourage you to look at the summary tables for the hormones. So I put a few summary tables at the end of that unit, and that will be a great way to test yourself, but also just to summarize the differences. But we'll do that here as well. So let's go ahead. Okay, and just quickly summarize some of the main differences between the fed and the fasted state. Okay, so we have the absorptive state, which I've been referring to as the fed state, and we're comparing that to the post-absorptive state, maybe it should be state. The post-absorptive state, also the fasted state. Okay. First thing is the hormone that's being released from each of these. So the absorptive state, the hormone that's controlling is insulin. Insulin is made by the beta cells of the islets of Langerhans of the pancreas. In the post-absorptive state, it is glucagon, which is made by the alpha cells of the islets. Let's look at their functions. So what are the different processes that are turned on in each of these states? So we've got things like glucose uptake immediately. So the cells of our body that need immediate energy will uptake glucose. So we have increased glucose uptake for immediate needs. I don't know why my M's have 3 loops, but hopefully we can see these are M's. Okay, so immediate needs. We also have increased glycogen storage or synthesis. Remember, glycogen is the storage form of glucose. So increased glycogen synthesis. For storage of glucose, we have increased triglyceride storage. Or increased triglyceride synthesis for storage of fats. All right, so this is storing glucose. This is storing fat. And then down here we have increased protein synthesis, which is storage of our amino acids. Okay. Also remember that there were some pathways that allow for us to store proteins as fat, as well as glucose as fat. So there are pathways that shuttle excess glycogen or excess glucose, excuse me, and excess protein into fat as well. We talked about fat being the main storage of our extra energy needs. So glycogen can be stored as fat as well, and then proteins can also be stored as fat. Overall, the main function in this state is to decrease our plasma glucose. Okay, and to store that away until a time when it's needed. Let's compare that to what's happening in the fasted state. This is after you've gone for a while without food. You're going to have increased glycogenolysis, which is the breakdown of glycogen. You're going to have increased lipolysis, which is the breakdown of fat. And you're going to have increased proteolysis. Okay. And so the overall function of the fasted state is to increase our plasma glucose. All right, which really makes sense. This is where you've gone for a while without food and you need to tap into your various storage areas so you can break down triglycerides to liberate fat. You can break down protein as a last resort to liberate protein. And then more commonly, you can break down glycogen to liberate glucose for your extended needs. So the main function here is to increase plasma glucose. All right. Any questions here? Okay, in the last few minutes, I'm just going to list off some topics that I'm not going to go over in detail, but if you found difficult, I would encourage you to review those separately. They are things that will be important for the exam. So go over each of the endocrine axes, right? So thyroid hormone, what is the releasing hormone for that? Cortisol, what is the releasing hormone? What is the trophic hormone for that, right? So ACTH, CRH, go over all of those axes that we drew out. That's going to be important as well. Go over the structures of the central nervous system. So know the function of your meninges, right? Know the function of your CSF. We also talked about the different glial cells. What are the functions of ependymal cells, astrocytes? How are they different from neurons? We also talked about the microglial cells, the Schwann cells, right, that myelinate in the peripheral nervous system versus the oligodendrocytes that myelinate in the central nervous system. Other things we talked about here was the blood-brain barrier, how the astrocytes and the tight junctions help to maintain that blood-brain barrier. And then just the classification of neurons as well. So we talked about sensory neurons, motor neurons, and interneurons. All right. We reviewed most of the somatic nervous system. Those are the important points that you should know for that. And then we also reviewed the autonomic nervous system. The endocrine system, I think we just talked about most of part 2, and then I mentioned the hormone axes for part 1. And then lastly, for muscle, go over the structure of muscle, right? The paramycium, epimycium, which of those layers covers the fascicle versus the fiber versus the entire muscle. Also go over the sarcomere, right? Your bands and zones, which is the only one that doesn't change. That is the A band. The area where there's overlap is the only spot where there isn't change. And then the function of things like titin, the function of tropomyosin, troponin, how they are regulated, right? And then lastly, the crossbridge cycling, the steps of that, and the excitation, contraction, coupling, and the steps of that as well. Okay, so if you have questions over the weekend on any of those topics, please reach out to me. I'll try to be pretty responsive before Monday.